One very salient measure of quality is the outcomes of care. Are patients getting better after they receive care, for example? These can be very important measures, and there are lots of efforts to measure outcomes. This can be the most sought-after type of measure, in fact. We care a lot about outcomes, but it's also a challenging area to measure. Let's look at some of the issues with outcomes measurement. The core idea here is we can define something we want to happen or not happen and see if it does or not. We emphasize the effects of healthcare on patients or on broader groups like people with particular conditions or getting a particular treatment, or even on populations more broadly. How is their health status, their quality of life, their life expectancy impacted by medical care? This could also include things like whether their behavior is changing or whether their knowledge is improved. Like other types of measures, these can be computed or calculated at multiple levels for many different entities: health plans, providers, physicians, hospitals, long-term care facilities, and for populations. By way of illustration, here are some commonly encountered outcome measures. One is mortality rates. We might look at mortality rates for patients with particular conditions or patients who receive some type of treatment. For example, we could calculate the mortality rate within 30 days after surgery for heart disease. Another common example is a readmission rate for a hospitalized patient. This might measure the share of patients discharged from a hospital after treatment for a condition who end up back in the hospital within, say, 30 days, perhaps for an unplanned admission. A common interpretation is that readmissions are undesirable, so an outcome that should be avoided. A third example would be a complication rate. What share of patients receiving a particular treatment develop complications of one kind or another after medical care? A related common measure is the rate of hospital-acquired infections. What share of patients acquire a new infection when they're receiving care in a hospital? A fourth example would be how often patients are admitted to hospitals for conditions that might have been treatable in outpatient settings had the patient received strong outpatient care in a timely way. Sometimes we call these ambulatory care sensitive admissions or potentially preventable admissions. These outcomes, measurement of them, are all focused on data and tracking of healthcare events and utilization. Another category of outcome measures focuses on patient-reported outcome measures. Sometimes these are called by their acronym PROM, or just PROM for short. These come in different flavors, including patient assessments of their health status, how does patient feel they're doing, or their health outcomes after treatment. And sometimes you get patient assessments of their satisfaction with their experiences and the care they received. Patient-reported measures are collected quite often. Patient satisfaction data in particular have become very common. Outcome measures have many attractive features, but they can also face challenges. One key challenge is the possibility that while variations in outcomes from one provider or health plan to another may be the result of differences in actual underlying quality, they could also be the result of other things, some beyond the control of providers or plans. For example, the characteristics of patients might matter. If one hospital takes care of particularly sick or challenging patients, it may have worse outcomes than another hospital that takes care of much easier patients, even if there's no true difference in quality. Depending on the situation, this can be a very important factor. There can be major differences in the patients cared for across providers, though there aren't always. As a result, doing a good job of measuring outcomes usually involves an approach to adjusting for this, which we often call risk adjustment. Risk adjustment methods are generally mathematical or statistical approaches that attempt to correct for differing characteristics of patients, such as patient health status, so that a fair comparison of outcomes can be made. This is an area where quite a bit more could be discussed, from the specific methods used to challenges that can arise. You'll find situations where people have confidence in the ability of risk adjustment to adequately account for differences in the risks of different groups, but you'll also find cases where there are debates and calls for improved methods. So there are some important things about outcome measurement, a really important area of measurement, and one that's getting a lot of attention.